Okay, so again, my name is Dr. Stephanie Nixon. I wanted to explain the goal or objective of these videos or this series that's going to be about my adventures trying to navigate what's currently going on. I do have a long medical history and a lot of experience navigating health insurance, both for myself and for my former patients that I used to work with. But some information that might help you, just the listener, whether you be a speech language pathologist, whether you be a student, whether you be a medical professional, whether you be someone else going through something like that, you're just going, what is happening to me right now? Number one, this is not intended for diagnosis if you are that person, but I do also feel that we can learn from each other. Some background, basically in 2019, I started another round of my back-to-back respiratory infections, including a ton of random bacteria that most people don't even get sick from. Let's just name a couple really quickly, but some of them are like Mycobacterium avium complex, Mycobacterium gordonii, and Pluralibacter, Serratia liquefaciens, Serratia marzicans, Streptococcus pneumoniae, Synotrophomonas multifilia. I mean, there is a long list. Oh yeah, Pastorella multicida, and a few others. So and Staphylococcus aureus. What happened was this all culminated with me going through multiple practitioners until I found an amazing pulmonary physician, and they determined part of this was Mycobacterium. I kept getting sick repeatedly. There's been a ton of testing. There is still unknown information. Fast forward to 2022, and about April, I started getting, I'd been getting back-to-back infections the entire time. And April of 2022 was another round of them. And in this one, it didn't respond. My immunologist tried to get in contact. We tried to get the correct medications. The medications were provided, and I messaged my then infectious disease doctor and said, hey, this isn't working. I've been on 5 days of Levaquin. I'm not seeing any benefit, and my left ribs are really hurting. And needless to say, nothing happened. I was told, oh no, this should treat that, and it wasn't heard. So then fast forward to finishing out the dose. I had messaged him a couple of times. I was told that medication should work. I kept saying it's not. Finally, I was told you should be seen. When I was seen, I had severe left lower lobe pneumonia. I was negative for COVID on that date. 9 days later, I was actually put out of work because I was not allowed to work with pneumonia. At this point, I'm out of sick leave. And I was just 9 days later, I'm totally out of leave. I am getting sicker. My O2 sats are dropping. They're in the 80s per my home O2 meter. And I ended up getting in touch with my pulmonologist, who told me to go straight to the ER. And basically, do not pass, go now. I tested positive for COVID at the ER in addition to my already existing severe left lower lobe bacterial pneumonia. And that bacterial pneumonia was not responding to antibiotics. It was a Staphylococcus aureus based and Mycobacterium avium complex. This led to my immunologist, another consult doctor that he knew, and my pulmonologist all discussing and me going on the big three. Big three include azithromycin, rifampin, and I'm blanking on the name, ethambutol. So I was on those 3 medications for about 14 months. Those started in August of that year. I was on another antibiotic at the end of June. I'll go into all of that later, but this is just in case this all relates, because I've also been tested for other reasons since that time. Now, with all that in mind, I have had chronic respiratory infections my entire life. But let's fast forward. In 2023, I started experiencing what seemed like neurogenic stuttering. And it was weird. I have had some word finding stuff going on, and you'll probably notice I'm slowing my speech because it seems to help sometimes. And amidst all of that neurogenic stuttering and all of those concerns, we assumed it was kind of like part of my migraine aura. I mean, hey, I've lost half of my vision on my right side before with my migraine aura a couple of times, but so it was kind of, that was the issue. That was what we all kind of thought it was. Or that's what I thought it was. And it was absolutely horrible. For those of you who have gone through stuttering every day of your life, oh my goodness, I have no words. My poor husband would try and talk and help me say what I was trying to say, and I'm going, that's not what I'm trying to say. No, stop. And I knew what I wanted to say. I could not make the words formulate. So I wanted to kind of describe that. It felt like they were stuck in my throat. To that end, my whole life, I have experienced things like esophageal spasms where, it feels like that pill is stuck in your throat and it just won't move through. I've even had it with food to the point that I've ended up throwing up. I've had issues with airway spasms. I don't know if they're bronchospasms or laryngospasms. Honestly, there isn't much you can do. But in July of 2024, I remember I was laughing about something and I was trying to get my husband to come upstairs so I could show him. And all of a sudden I could not breathe air in. And I remember the air just got stuck and nothing would move. And I was like, and so I know from our voice classes as a speech language pathologist that one of the biggest things I needed to do was to make sure I don't panic, because there's nothing you can do. So finally, I was able to get air in. I was running to the bathroom because issues. I was trying to breathe and nothing would come out or in. And it felt like it was just clenched, just so tight. And finally, when I was able to inhale, there was stridor, what's called laryngeal stridor. I was like, like that. And I was like, oh God, okay, I'll be okay. I can breathe now. And then I finally started coughing. I was crying. And later, there were actually what's called petechiae, those little bruised dots underneath my eyes. So it was pretty scary. And it's not the first time it's happened, but it is definitely scary. And so I'm describing it just in case it's related. And similarly, when that stuttering episodes happen, it's like everything gets so tense in here, in my neck, in my shoulders. It just clenches, kind of like when you get a Charlie horse. But for me, like when I get Charlie horses, there's spasms of my entire calf, my entire, like almost my whole leg muscle, it feels like. And it takes a days to unspasm. It was similar to this. And it's scary. It's very scary. And the same thing happens when I'm trying to talk at times. And I can't pinpoint times that it gets worse or better. I thought before it was around migraines. That's why it seemed to be an aura. But it's not quite fitting. So I'm going to kind of show you what I started to look at. I'm also going to kind of explain a little bit about what I've been going through. And I'm going to try and date the video so you can see and what's going on, and clip them together. So hopefully this can help take you through my story. Thank you so much for your time. And again, if you have questions, do not hesitate to contact me. Okay, so now before I go on, these videos today are obviously from January 27th. I tried to record the same intro on January 12th, and you can definitely hear me pausing a lot more. Basically, after that evening, I started taking a medication that helps stop spasming because I was dealing with spasms in a lot of different areas. As a reminder, I have cervical stenosis, I have history of lumbar stenosis, and the cervical stenosis is pretty severe with 2 herniated discs and a multilevel cyst. So with that in mind, I'm going to now show you a video of when I tried to record all of this information before. Hi, my name is Dr. Stephanie Nixon, and I'm recording this for future students and also for faculty in speech-language pathology. I worked as a speech-language pathologist between research and practice until 2022. I've always had issues, so let me go. So now, fast forward, as a person who obviously has somewhat of an odd immune system or difficulty with my cilia moving stuff out of my lungs, it is very challenging for me. But in addition to all that, with that many years of coughing, not to mention the years prior to that where I kept getting bronchitis and things, I was also dealing with a ton of pain. I also do have fibromyalgia, among other health conditions. And so what ended up happening was I was formally diagnosed with lumbar stenosis between L4 and L5. And then, as I had kind of forgotten years ago, in 2002, I was diagnosed with actually cervical, what was it? I had radiculopathy. There was basically a mild bulge at C6 and C7. It wasn't herniated. There was no spondylotic foraminal or spinal canal stenosis, but just a mild generalized bulge. Otherwise, it was unremarkable. Okay, so let's actually go back. And as a good SLP, I was like, hey, if I keep getting these respiratory infections, let's just make sure I'm not aspirating. Okay, so now before I go on, these videos today are obviously from January 27th. I tried to record the same intro on January 12th, and you can definitely hear me pausing a lot more. Basically, after that evening, I started taking a medication that helps stop spasming because I was dealing with spasms in a lot of different areas. As a reminder, I have cervical stenosis, I have history of lumbar stenosis, and the cervical stenosis is pretty severe with 2 herniated discs and a multilevel cyst. So with that in mind, I'm going to now show you a video of when I tried to record all of this information before.